Hello everyone and welcome back to another episode of the All For One podcast. Now today is a particularly exciting episode because you can see us as well as hear us. Now you might have noticed I've done a little bit of work on my home studio here, and following on from the last episode with Mr. Motivator, I decided to get the panel together on video, so it's a new way for you to get involved with the All For One podcast, and it's a panel full of fresh faces. So let's go around and say hello to each and every one of them. So Elise Quarrington is joining us for the first time today. Now Elise is an NHS midwife and an athlete, and you were only diagnosed a few years ago.
Yeah, I was diagnosed 3 years ago yesterday.
Oh, happy diversary.
Thank you.
Next up, we are joined by Reece, who is on Instagram as Reepsy. You'll be able to find him there. He's also beginning to blog about his life with type 1 diabetes. There's the T1D. How are you doing, Reece?
I'm good, thank you. Yes, guys. I'm a bit longer in terms of my diabetes diagnosis, so I'm at 10 years now. So, thank you for having me on.
And someone who knows just how it is to live with diabetes for over a decade is Sam Barnett, who has lived with type 1 for 17 years and calls herself a goody two-shoes when it comes to diabetic rules. What are these diabetic rules?
I just find myself a bit of a goody two-shoes when it comes to what the hospital want you to do to keep your HbA1c stable.
Well, I'm sure we'll learn a bit more about that later on in the episode, but that is today's panel, and don't forget, you are the fifth panel member, and we want to hear your thoughts on today's discussion. You can get in touch on social media. On Twitter, we are at All For One Tweets. On Instagram, we are at All For One Insta, and on Facebook, we are at All For One Online, or you can send an email to contact allfor1@gmail.com. Now, coming up in today's show, we're going to be finding out how safe it is to go back to work. We'll hear from someone with type 1 diabetes who's actually recovered from COVID-19, and we'll be hearing from Paul Coker too about his fundraising event in which we can all get involved in at home. But let's start today's podcast with a story that's no doubtedly been on many people's minds. I, like many of you, was very concerned when I read in the papers that people with type 1 diabetes have 3.5 times more risk of dying in hospital with COVID-19. Now, this must have been quite a shocking headline for most of us to read. How did you guys feel when you saw that news?
Yeah, I felt I think because I've been at work the whole time, it's been, quite at the forefront of my mind the whole time, I guess. And then when that research did come out, they moved me, my manager's been great, and they moved me straight to the phone line. So I'm now working just answering the emergency phone and triaging women instead. So I'm not patient facing anymore. I think it's definitely had an impact.
And obviously that risk is even greater for people in the BAME community. So Reece, what was that like for you when you found out?
We had to wait a little while to just get, some more figures and a little bit more analysis around it. And a lot of people around me, like my family, become sort of extremely worried because not only, am I a member of the BAM community, but I am a type 1 diabetic as well. And it was a bit confusing because I'm lucky enough to have been allowed to work from home. That's got a review date of the end of July. So I feel quite safe. I can go out and explore, but it's made me feel really nervous just to do the normal things that I was doing when lockdown first was implemented, just going to the stores. My fiance has a heart condition as well. So it's are we just going to be on lockdown and further notice, when the world seems to slowly be getting back to normal. But it was really, really worrying news when it first came through.
That's the point I think that a lot of us are at, looking at this, lockdown that will continue for a lot of people with health conditions. Now, we're not currently being asked to shield with type 1 diabetes. We'll get into a little bit more of the data in a bit and just sort of contextualize that risk of what it really means to people. We're just really sort of scratching the surface for our initial reactions here. But you're right, it does seem like it's never really going to end. And as lockdown sort of starts to lift in different areas, we're sort of faced with that decision, well, can we go and see our family? Can we go and see our friends? And can we also continue to justify staying at home and working from home? Now, Sam, you have been sort of leading your family through this whole scenario, and I guess, you know, looking after kids and all that sort of stuff, it's hard sometimes to really put, you know, your condition first. So what was it like for you when you read that story?
Yeah, I don't feel that much different having read the story. I have a lot of family members who do feel different having read the story, and they believe that maybe I should be almost going towards the shielding point. For me, I've done everything the government have allowed me to do. So I have been going out, I have been shopping, I've been playing tennis recently because it's allowed, but I've followed government guidelines on everything I've done. I've been very careful with wearing gloves, and everything you're meant to do, I've done. And I don't feel like I've put myself in any more harm than I had before that data came out. And to me, I don't feel that different from the data than I did before.
I think a lot of the risk is to do with age categories, socio-economic risk factors. A lot of different things are at play here, and it really has to be said that out of the data that was compiled, a lot of the people that have died of COVID-19 with type 1 diabetes, the majority, as is the case with everyone else, are older age groups with other comorbidities too. So it's really important to not let this scare us too much, but not to be too uncautious about it, because you know it is obviously an increased risk factor. But I put the question to people online, and Zoe Gant said that I feel there is a lot of conflicting evidence out there, though. You are high risk if your BMI is too high or too small, high risk if your control is very poor or too good. So I'm not sure about the control being too good. That's definitely, I believe, from what I've read, a way to sort of increase your chances with this. But definitely if you're experiencing hypoglycemia or you have fairly poor control, then that is going to increase your risk factor. Rana Hurst said, I was concerned to hear the news on statistics. I am from the BAME group, overweight for my height and over 40, although my control is generally good. So I'm concerned where that might place me when it comes to associated risks. And yeah, that's the thing with a lot of people. A lot of people can put themselves into these different categories, and it will be making them very worried. But sooner or later, you know, we are going to have to accept a bit of risk and try and attempt to get back to normal. And the final comment here from Brienne McDowell, who said, my husband ended up with it from his job. I've been diabetic for 30 years and maybe got a mild case of it. My kids were fine. So that was just a little a take of the temperature of what people out there are feeling. So what we're seeing is a lot of confusion still. So from, you know, or if you've managed to read into any other parts of the stories, do you guys feel a little more understanding of what's really going on?
I feel like, you know, we had, like you said, we had that data. And for me, I realized that everyone who's, you know, who has type 1 diabetes is totally different and individual. Their bodies react to foods in different ways. It reacts to different types and brands of insulin in different ways. So I feel that, you know, there's going to be a lot more questions to come from the data. I would hope that there's not kind of like a blanket review of type 1 diabetics, and you know, every single one of us is asked to shield, because I understand it is being reviewed. However, I think that, you know, if there are some circumstances and factors that can be taken into account, such as age, your HbA1cs, and that kind of data, and your general control overall, then I feel that would help a lot of people, rather than just extending a blanket ban or like lockdown to all type 1 diabetics.
And I think that's the issue here, because there's still a lot of uneducation, miscommunication with who people with diabetes are and what that means for their lives. As we know, all of us here with type 1 diabetes, that means a lot of different things, and that probably means in some cases that we're generally a lot healthier than the rest of the populations. But just like what happens with a lot of diabetes related stories, the headline doesn't really ever tell you the full story. So you do have to dig into the data to really get to grips with what's going on here. And there's a video which I want to share from Partha Carr, who's been doing a great job of helping us to understand what's going on. Partha Carr even got himself a blue tick on Twitter recently, because he really is the font of knowledge when it comes to what's going on with diabetes. So I'm going to play that video now, and hopefully it will sort of let us understand a bit better what is going on.
Hi everybody. So the diabetes data has come out around COVID-19 and deaths, and understandably with a lot of worry and anxiety. So we'll try and, as a system, try and support everybody. But just a quick few things to sort of mention. Don't forget that the most important determinant in this is age. And the average age of death in type 1 diabetes was around 72 years old, and for type 2 diabetes was about 78. As with anything across the board with COVID-19, age continues to be the big determinant. Type 1 diabetes does indeed carry more risk than type 2 diabetes, but for parents out there, which straight away raises anxiety, I think it's important to note that the absolute risk below the age of 40 is low. Until the data has been analysed there's been no deaths recorded below the age of 20. So that's reassuring, and we are speaking to pediatric colleagues and associations to look at their views as well. As regards shielding, all the data has been given to the Chief Medical Officer to consider, but as is very evident from the data, it's not binary. It's based on your age, your glucose control, your weight. And I think on that note, the important things to mention is that there are a couple of things which we can't modify in life. We can't change your age, we can't change your ethnicity, but we can probably impact on the weight as well as the glucose control. It's important also to look at the data, which suggests that you want to have an optimal range. It's not about being too low in any respect, so that's an important message as well. But another thing which we should not forget is the issue of socioeconomic deprivation. That's something which is modifiable to an extent, and we all have a part in it, so please let's not forget about that either. But overall, the data hopefully should help shape what we do next, where we are. The NHS is here to help. We've got a national advice helpline set up, and there are self-management platforms coming out for type 1 diabetes, type 2 diabetes, all to help people. And there is no lack of people out there to help. So stay safe. We're here to take questions. Keep washing those hands, and there is no doubt at the end we'll come out through this.
Okay, so that was Partha Carr there. Some actually quite useful information. I think he's brought up quite a few important points there. What the biggest thing really for me in all of this is it's not a great leveler, COVID-19. What it has done is sort of brought to light a lot of the sort of social issues that people might have thought were gone and sorted. What it has sort of proved is, there are major vulnerable categories here, especially people living with type 1 diabetes, who, really should have that blanket of support there from society when they need it. As we've seen, lots of frontline workers aren't in the top high paid positions. I'm not driving a bus, I'm not working in a supermarket. The people that are out there doing that still and have been throughout this COVID-19 pandemic, they are the essential workers here. I mean, if I stop working tomorrow, I'm not sure anyone would notice, but if people like that weren't able to go to work, that would be a major issue for the country. So after we've heard that video, we've heard what Partha Carr has said. He's NHS Sugar Doc on Instagram if anyone wants to check it out. What are your thoughts on all that information now?
I think, for me, now that the research has come out, it's actually been not I don't know what the right word is, but it's not been obviously what we wanted to hear. But having research is better than not having any, if that makes sense. So it's kind of reassured me in the sense that, you know, we're starting to get the data on it. And I think what he said about the fact that we're in control of, or slightly in control of, our HbA1c and how good our sugar control is, and focusing on like our diet and doing exercise and stuff in order to get better sugar control, rather than focusing on something that's so out of control, like if I'm going to catch the virus, you know.
So Sam, as the queen of HbA1c control, it's obviously something that you take very, very importantly, as we all should. Let's not get away from that fact. It should be at the top of all of our priorities. But as someone who, you know, prides themselves on that, that should make you feel a lot better, a lot more comfortable, that information there from Parthakar.
I have to say it does and it doesn't, because as well as my HbA1c is not perfect, it's what I would like to think is good, and it's what the hospital tells me is good, and I strive very, very hard to get that as well, and I work hard at it. But at the same time, I also come into the overweight category. I try very hard as well with my weight. It's an issue, but I exercise every single day. I exercise multiple times a day, and I would like to think I am fit and healthy with a decent HbA1c. But the whole overweight thing then screams something else.
Is that by measuring your BMI?
I don't even like to go there, and I have no idea at all. For me, it's what it says on the scale.
Because I know that the BMI isn't a great way.
Totally.
There's lots to decide. I think it's a very sort of raw and sort of simple way of, you know, getting a good idea of where, but I don't, because I mean, I've got friends who are really, really muscly guys, and they are considered, you know, clinically obese because of the BMI scale. So I wouldn't let it, like you say, I wouldn't, you know, sort of live your life by it.
No, but you see, so then my concern then for me, and purely for me, is after the information has come out, somebody is going to say, if you are overweight and over a certain age, probably 40, then there's a possibility you may have to shield. And that obviously they can't look at every individual's HbA1c and personal circumstances. And if I was made to shield, that would be a huge, huge big deal for me personally.
Well, I guess what I've been doing is essentially shielding. I mean, I haven't seen anyone other than people that I've passed in the street that I know on like a daily exercise. So I guess that's not, you know, classically shielding if I was, you know, having that exercise and going to the shops and stuff. But otherwise, I think I've been pretty much shielding. And I know quite early on, a lot of people thought we were going to shield when we were waiting for the news, the advice from government. A lot of people thought people with diabetes and type 1 diabetes would be on that list. But I think what maybe had happened is, because there is such a spectrum of this condition and how it affects people, there's no one case, as Reece has said, there's no one way that it affects everyone. That maybe sort of informed the government decision otherwise. And the pure fact that 4 million people in this country have some form of diabetes, so that's a lot of people. The logistics of asking 4 million people, when I think the final shielding list was about 1.5 million people. So I mean, maybe it was down to that. Maybe it was down to the amount of people that would disappear from the workforce, from society, and then would become an extra burden with getting medication and food to them. So maybe that had a hand in it too. But like Sam said, you know, it could change. We could be asked to shield. And I think when lockdown is being eased, a sort of order to shield for people with type 1 diabetes might not go down too well, since we've already had to endure.
I don't think it would go down very well with my dog. I really don't.
No. I mean, what a saviour is it though to have some animal company. I've got a cat and he's kept me going through this. So I'm sure lots of people.
For me, it's more the fact that my dog wants to be walked every day. I have to go out every day on a dog walk, and that is a saving grace for me. To have to do that dog walk is lovely, especially with weather.
Yeah, it's fantastically sunny in Bristol today. I can't wait to get outside in the garden. But it is really important to mention, though, if you have diabetes, you are no more likely to catch coronavirus than anyone else. And the majority of people who do get coronavirus, whether they have diabetes or not, will still have mild symptoms and won't need to go to hospital. The most important thing anyone with diabetes can do is try their best to manage their condition carefully, keep their blood sugar in range as much as possible, and to follow social distancing rules. Don't forget, we're going to be hearing from someone later on with type 1 diabetes who's recovered from coronavirus, so stay tuned for all of that. And if you want to get involved in the discussion, then please do so on our social media. On Twitter, we are at All4OneTweets. On Instagram, we are at All4OneInsta. On Facebook, we are at All4OneOnline, and our email address is contactall41@gmail.com. And like it says in the logo, the 4 is a number and the rest of them are letters. Right, in a moment, we're going to be talking about whether it's safe to go back to work, and we'll get an update on the latest news in the type 1 world. But first, here's Paul Coker to tell us about his latest event to raise money for JDRF.
Hi, my name's Paul Coker. I run a website called onebloodydrop.com, and that's all about helping people with type 1 diabetes to exercise safely. I've been living with type 1 diabetes myself for 43 years now, and I'm running a project to help one of the charities that is involved in finding a cure for type 1 diabetes. The charity is called JDRF, and the project is to get 874 people living with type 1 diabetes, so that you've got it yourself or a member of your family does, a friend, and on the 14th of June at 10 a.m, the idea is that we all go out from our homes and we walk for 1 mile. The point of this is it's the last day of Diabetes Week in the UK, and 874 miles, which is the collective distance that we will walk, is the distance from John O'Groats to Land's End. And if we all donate just £1 to JDRF for doing that, then of course we make a significant contribution to their fundraising, which will all go towards finding a cure for type 1 diabetes. Yeah, so I have a history of organising fairly large groups of runners with type 1 diabetes to come and run at half marathons with me. And this year, because they're all cancelled, I decided that I wanted to do something different, and I didn't want to try and organise something at any mass participation event. So I began thinking about what can almost everybody do. And given that many people may be struggling financially during COVID times, I wanted to do something where price was not going to be a barrier. So there's no entry fee. It's just a case of donate £1 to JDRF. And, you know, even if you can't donate £1 and you can't afford it, I'm kind of okay with that. You know, come along and actually just do the walk, be part of the community. But of course, if you can donate £1, you know, every single pound helps. Yes, I think so. And I think that it means that we need to think differently about how we actually support those charities. As you say, things like the London Marathon, they've been cancelled. Lots of the other events have been cancelled that charities have relied on to be big fundraisers for them. Some are deferred to later in the year, and it remains to be seen whether they're going to go ahead or not, because there's always this fear of a second wave of COVID. So I think we just have to find novel and new ways to actually help the charities to go and help us. And this is just one example. I've never done this before with this number of people and an event like this. I've got my fingers crossed that it's going to work, because of course it helps to build a sense of community of people with type 1, and it helps the charity, so it's win-win.
Paul Coker there. For more information about the event and how you can get involved, you just need to go to his website, which is onebloodydrop.com. Now, charities are obviously going to suffer quite severely through this pandemic. The London Marathon didn't happen. That's cost charities millions and millions of pounds. And as people with type 1 diabetes, we rely on charities a lot. And it's one of the areas that I really haven't let myself get concerned about too much. But thinking about it, that's actually quite a worry. If JDRF and Diabetes UK disappeared, what would we do?
Have a lot less research.
Yeah, that's one of the main things, most important things, aside from just being a support network and all that sort of stuff. They are the ones who are leading the research into the condition. But is it our duty to support them? But people are losing their jobs left, right and centre, so it's harder than ever to give to charity, isn't it?
Yeah, they're going to lose a lot of their bread and butter from things like the London Marathon, as you said, that they rely on every year. And I'm sure that people like JDRF and Diabetes UK have a certain amount that they know they're going to receive every year from those events that haven't happened this year. Hopefully the money will still come in, and hopefully it will still go ahead in October, as they have been saying it might be, and they won't totally lose out. There is also government funding, I think.
Yeah, I mean, I know a lot of the Diabetes UK staff have been furloughed, and there is still sort of stuff, you know, I still get press releases and things like that, so things are happening still, but I think they're working on a much smaller staff base. But I mean, I don't feel like I can't see myself getting involved with, you know, a charity event where lots of people will be getting together for a very, very long time. I mean, do you guys normally, you know, take part in that sort of stuff, and how do you think it's going to change for you guys going forward now?
Yeah, I think like a lot of because I do a lot of sport events, and a lot of them have been cancelled obviously this year. I don't think anything's going to go ahead, and even into next year maybe some swim, like open water swim races will go ahead, because you can, you know, you're not too close to people. But I don't think anybody's going to be wanting to go to, you know, festivals and jumping to the chance of being in big groups of people anytime soon, I don't think.
I think that's what we've lost. That's the thing that I'm realising now, the fact that, you know, a community of people can come together without a care in the world has pretty much vanished. I mean,
yeah.
As a race, as a human race, we've only really eradicated one disease. I think that's smallpox, one virus. So, you know, we're living with this now, and it's a communicable disease, but
it'll be interesting if like other smaller bugs and things are being killed off, because everybody's now washing their hands and not passing other things around to people as well, you know.
you know, but on that, I think that's, you know, doing damage to people's immune system as well, because our immune system is strengthened by exposure. Yeah. So, you know, it's I wouldn't like to be a scientist or a policymaker right now. There's so many things to contend with. But whilst we're getting into some quite deep topics there, it is time for a quick break now. But when we come back, we'll be asking, is it safe to go back to work? And we'll be hearing from a lady with type 1 diabetes who's recovered from COVID-19. That's all on the way here in just a few moments' time.
Hi, it's John Sell here, just letting you all know that finally my film Hypo is now available on Amazon Prime Video. It stars Patrick Robinson from Casualty and Strictly Come Dancing fame, Mr. Marcus Griffiths from Holby City, and a nice little cameo from the Type 1 supreme legend that is Mr. Ben Coker. And I'll leave you with the tagline: when all you need is sugar, life stops being so sweet. I hope you all enjoy it.
Hello everyone, welcome back. Just a quick reminder to those listening to the podcast, you can also see us now if you want to do that. If you think your eyes are ready to see this ugly mug, you can head on over to my YouTube channel, which is youtube.com/JamieLowe TV to see the episode in full, or just search for the All for One podcast on YouTube there. Today's episode is all about navigating the new normal, living La Vida lockdown, and as the lockdown begins to ease, are we all going to be going back to work? So Reece, you're working from home until July. Will you be keen to keep that in place?
I'm actually like, you know, I think a lot of people now just want to get back to work. We used to complain about waking up early and, you know, doing that daily commute into work. But I think everyone now really just wants to get back to normal. My day job is in the youth job and youth and community field. So my work is, you know, direct and face-to-face work, which I haven't been able to do. And, you know, for the young people that we do work with and engage with, initially, I think for them, it was okay. They got a bit of a break from us. But now, you know, they're starting to lose a little bit of that structure. So, you know, there is a need for us to come back and start building up those relationships. But I'm certainly keen to get back into work, doing the direct work that I really enjoy. It's just I have to really consider at that point where are we in terms of coronavirus and the control? What are the social distancing guidelines? Because bringing a young person into kind of a small, cozy room to do a direct work session isn't going to be able to be done. How can we use technology such as Zoom to carry on doing that type of work? So there's lots of different factors there, but certainly for me, I'm quite looking forward to getting back and going to work.
And Elise, just like Reece, your work is very people-facing. I mean, that's the whole reason, I guess, why you wanted to be a NHS midwife. It's because, it's that sort of area that you feel really passionate about, the caring of a new mum and the delivering of a baby. So are you quite keen to get back to doing what you were doing before?
Yeah, I think it's obviously, I've been lucky to be able to be put on the phone line and not have to be taken out of work completely. At least there's something I can do. But yeah, I went into the job to be there for women and for partners and to be patient facing. So yeah, I am really looking forward to getting back to work. I'm quite bored of my phone voice now.
And in terms of me, I mean, a lot of people will have seen this. This has been my area of work. This, I guess, probably 4 by 3 meter room here, with lights and cameras and screens in it. This is where I've gone to work, and I'm getting a bit tired of the endless Zoom interviews, and I'm sort of losing the inspiration that I had, because I'm doing the same thing over and over again. But the alternative would be out and about, interviewing members of the public every day, going to various different locations. Because I work in news, no doubtedly the majority of them would be coronavirus hotspots. So when I think about it that way, I think I'm probably keen to remain sort of working as home for as long as possible, which, I mean, as I think a lot of us have proved, we can do some portion of our job from home. But Sam, what's it like in your area with your friends and your family? What's going on with returning to work in your life?
So I don't go out to a job. I am very much a homemaker, I'd like to say.
It's still a job. It's still a job.
It's the hardest job is the fact that I do have a husband who was basically told to work from home starting 2 weeks before the official lockdown. So, I mean, having to deal with that's been a job in itself, along with having 2 adult children, I like to call them, at home as well, who've also both been working from home. So essentially we have 4 adults in a house all the time and a dog, which has been testing at times. We've got on very well, but just the fact that I've got one person who needs a lot of Wi-Fi for important work calls, a daughter who's been doing university lectures online needing Wi-Fi, a son also doing lectures online needing Wi-Fi, and at the same time I'm going, yes, but I want to do a dance class and that's on Zoom and that needs Wi-Fi. It doesn't always work. So those logistics, very frivolous, but it's its own logistics.
Absolutely,
well,
that's entirely valid. It's can our home system support it? And let's not forget, with us all working at home, our overheads are going up. We're paying for that Wi-Fi, that electricity, that heating, even though we don't particularly need it now, but we did when lockdown started. Those are costs that we're incurring, and of course we're not going to go to our employers cap in hand, because I think a lot of us are quite grateful to continue to stay in our jobs. But it's worth considering the impact on our home lives, and that's probably one of the main reasons why I didn't go to live with my parents through this, because I really need a solid, strong internet connection to do what I do, and it just would not be possible. I've tried it in the past to work from my parents' house, and it's impossible, because the upload speeds are so slow, because like you mentioned there, Sam, they do live in the sticks and Wi-Fi is terrible out there. But there are things to protect us. So if you're not feeling safe about going back to work, then you can do something about it. As someone living with diabetes in England, Scotland or Wales, your rights to work are set out in the Equality Act of 2010. So you're also protected in Northern Ireland too. They've got the Disability Discrimination Act of 1995, so you can and should ask for reasonable adjustments to be made wherever possible. And I think I would encourage people to work from home while they still can, while we're still finding out about how we're going to live with coronavirus and COVID-19. Because I think although a vaccine is becoming quite quickly not viable, there are treatments and therapeutics in other drugs which could help people to live with the condition. But Elise, you have some responses from your social media followers. What are they saying about returning to work?
Yeah, I had kind of interestingly polar opposite ends of responses. I think it's probably quite dependent on what jobs people do as to how they feel about going back. So I had one lady who's a journalist and she's not keen at all on going back yet, and that's mainly because of exactly, anything kind of people facing, I think, where news is going to be. Whereas a few other people were very much not wanting to stress about it at all, not thinking that it's that diabetes is going to impact them. We're trying not to have that attitude of thinking that diabetes will have a bad impact on going back to work.
And let's not forget, there's a whole army of people like yourself that haven't been able to entirely work from home. There's a lot of people who just haven't thought it, pertinent for them to stay at home. A lot of people just didn't, either couldn't because they needed to go to work, self-employed people particularly. They worked in essential areas, so key workers. So a lot of people will have still had to go out there and take that risk themselves. But just in terms of the people that I spoke to on social media, so Pete Harris on Instagram said that he's a painter and decorator. He stopped working for a few days to get his PPE in order, and other than that, he's returning to work, but he is still turning work down left, right and centre where he doesn't think it's safe. Maria Greenwood said that she works for the NHS, so she didn't really stop working except for the time when she had symptoms, so she had a week off then. And Nicholas Adams said that he's type 1 diabetes and has had to make the agonising choice to work during this crazy time, as he's considered an essential worker. He's getting no hazard pay and initially no PPE, so he had to buy his own. You might say that he shouldn't have worked, but if I had, my workers' insurance would nearly have run out by now, and I have to pay for the basics like food, insulin and sundries. He says he is worried, but what choice does he have? I think it's important to mention there that I think Nick was getting in touch from the United States, so a very different situation over there again. And Mandy Dibble says, I'm a flight attendant and I've been flying during this whole thing. Haven't been sick or anything. Luckily, I'm going to continue on with life as normal and being careful, but continuing to work. Don't forget, if you want to get involved with your own opinions about returning to work, is it safe to do so? You can get in touch on our social media platforms. On Twitter, it's at All4OneTweets. On Instagram, it's at All4OneInsta. And on Facebook, we are at All4One Online. But, we are protected when it comes to diabetes and work. We can ask for the reasonable adjustments. But are we concerned that this is going to hamper in some way our employments or career prospects going forward?
For me, moving forward, again, going back to the kind of field that I work in, it's always been quite challenging, especially for voluntary organisations to bring in funding. And even in the more statutory council departments, there's been cuts from the financial crash happened. So 2010, severe cuts were made to the youth and community sector. And whilst the government has put in, some support for businesses and individuals that may be self-employed and stuff, there's always one of my eyes are always on, how are we going to pay for this? And I can just see a cut to those kind of services coming again. I think it might fall down some local authorities' lists a little bit when it comes to recovery, financial recovery. So I'm a little bit worried about that, and the facilities and things that are available for young people once we start returning back to normal. So that is a big concern for me.
And it is those sorts of things which go first, isn't it? Like we saw, well, like we've been seeing in these austerity times of austerity measures, we've seen a lot of services that weren't deemed sort of, critically important completely disappear. And a lot of councils, like you say, are facing massive black holes in terms of their funding. So Bath and North East Somerset Council, they're looking at a £50 million plus deficit. And that's purely because Bath's a tourist city, so all of their income has stopped. No one's parking in the ridiculously expensive parking spaces. So that's a cut on their income, and the grants that have been given out to government, to local governments from central government, haven't really sort of filled the void. So yeah, we are heading into a bit of an uneasy time. I'm a bit concerned as well because a lot of my stuff doesn't happen in my 4x3 box room. A lot of stuff happens in terms of travel and requires me to be going out and doing things all over the world and meeting people all over the world. So I'm just a bit concerned whether I'll have to have the agonizing decision of turning down opportunities, because I just don't like to. I mean, especially because of diabetes. I'm sure you guys would agree, when you get a diagnosis like this, you will do anything to make sure that it won't hold you back. But now we're sort of having to potentially make that decision.
See, I'm still finding, personally, I still feel like I want to live each day, not be scared, not be shielded, to be careful, to do what I'm meant to do, but to live. Because there's so much time where you can't, you're given this diagnosis, as you say, you don't want it to then define you. And I don't want to be in a point right now where I have people saying to me, you can't do this because, you can't do that because.
Yeah, diabetics are quite used to like weighing up everyday risks, aren't we? If you inject too much for a meal, then that's a risk. If you don't inject enough, that's another risk. Like it would just be something else, to add into it.
That's I guess a bit of a hypocrisy, because I was dead against that. I was like, no, I'm gonna do it more because I'm type 1 diabetic. Don't care what you got to say. I can do it. I can run that distance. I can go out with my friends. I can do whatever I want to. But now, because of this pandemic, I'm making the reverse of that decision. I'm saying, because I'm type 1 diabetic, I can't go to work right now. So it's just really interesting how the context has changed and how I'm doing what I thought I would never do.
So for me, I've always been the same as you guys. I've always, someone told me I can't do nothing because of my diabetes, I'll go and do it 10 times over just to show that I could. And there's nothing stopping me. But now there's actually a little something for the first time ever that's just in the back of my mind saying, if I do go and do that, maybe there is a point and maybe I can't do that and shouldn't be doing it. And that's really frustrating. But like Sam, I'm still going to remain positive, optimistic about doing those things. It might take a little bit more effort for me to push myself to do it, but I'm going to try my very best.
Absolutely. And it's just the decisions, when they come, they're going to feel a bit unnatural and a bit uneasy. But I mean, we all do have to, nothing is completely risk-free. And I think everyone goes about their day with a bit of risk, especially us living with type 1 diabetes. So I think once we understand what's going on a little better and how we can sort of control the spread and what the true sort of death rate is, what the mortality rate is, for the wider population, when we get all the figures in and hopefully when we start to become, immune, because maybe we've been asymptomatic and we can prove to ourselves with an antibody test that we've had it, we didn't realise, and we can now return to the world. But I think that's what I'm waiting for, actually, an antibody test. I think that would tell me that I'm sort of safe to return to society. But in a moment, we will hear what it's like to have type 1 diabetes and coronavirus too. But before then, it's time for a news update from Adam Lawrence.
It is safe for children with diabetes to return to school. That's according to the Association of Children's Diabetes Clinicians. Many parents have expressed concern about allowing their child to return to school after the government announced that pupils in reception, Year 1 and Year 6 will begin a phased return from the beginning of June. But the ACDC has said that it is safe, providing protective measures in line with national guidance have been put in place. According to the recent diabetes and COVID-19 mortality rates data published by NHS England, there have been no deaths recorded from people under the age of 20. High blood sugar levels have been linked to poor pregnancy outcomes, even among women who do not have diabetes, according to researchers. In 2007, a Canadian team started a new study which would look at the association between HbA1c levels and severe maternal morbidity. For 8 years, they studied data from more than 30,000 women aged between 16 and 50, and 90% of whom did not have diabetes. The researchers from the University of Toronto found that the risk of SMM, or death from 23 weeks gestation to 6 weeks postpartum, was 2.2%. And an up-and-coming rugby league star with type 1 diabetes has spoken out about how he manages his condition alongside his sporting career. Cameron Scott, who is currently on loan from Hull FC and playing as a centre for Leigh Centurions, was diagnosed at the age of 14 but refused to let the news get him down. Speaking to the Yorkshire Post newspaper, the 20-year-old said, "Instead of rolling over and letting it take control, I just took over it. It was one of those things where I knew it was going to be with me for the rest of my life. So, it was just a matter of getting on with it." That's the latest from the Type 1 world. I'm Adam Lawrence.
I'm Elspeth Kerr. I live in Glasgow, and this year will be 31 years I've been diabetic. I battle with it. I always describe it as I work really hard on it and it does whatever it wants. It was about the 15th or so of March. I was coughing and I just had a slightly raised temperature, so it was like 37.8, something like that. And I started coughing, and it was like the bottom of my lungs felt as if something was being stabbed into them when I was coughing. I didn't even phone 111. I thought, I'm not ill enough to need any help yet, but keep an eye on it. Obviously, keep an eye on my sugar levels, which were raised because of infection. That's how I knew there was something definitely wrong. So, and I had an argument with somebody online actually about it. I said, "Well, I've definitely got something. It could be that because my sugar levels are raised," and they argued with me that didn't happen with diabetes, but it definitely happens with mine. As soon as my sugar levels are like really raised and they just won't come down at all, that's how I know there's some kind of infection. I know that, as I say, I know whenever I get ill, that's what happens. My blood sugars go through the roof and I have to take more insulin to try and bring it back down again, and keep an eye on it for a couple of days. I'll keep more of an eye on it for a couple of days. I'm a local councillor in Glasgow City Council, so I've been working from home. I've just been arranging volunteers to be able to go and help other people, but I've been doing it all from home. All I've been going out is my walk each day, and if we go to a shop, I stand outside the shop with the dog and I don't even go in.
So we are coming to the end of today's episode, but what have we learned? Is there a new normal? That's something we will have to navigate ourselves. So how do we feel after this discussion? I mean, I know it's really bad to say this, but I sort of still have more questions that aren't answered yet. I don't think I'm feeling completely, resolved with what's going on because, I still just don't know yet. How are you guys feeling?
Yeah, I think the same, but equally I feel like it's nice to know that we're all in the same boat, as in, because I'm quite new to the diabetic world. I think learning that there's communities out there of people that is, everybody's in the same position, whether we're going to work or not going to work, we've all got type 1. So I think, obviously the more research that comes out, the better, but I feel all right about staying where I am at work, obviously, for now.
Staying where it's safe. Sam, how are you feeling about it all?
Yeah, no, I feel the same at the moment as I did a week, 2 weeks, 3 weeks ago about it. Going to carry on doing what I'm doing. I'm going to carry on following government advice, not going silly, throwing wild parties or anything like that. Equally, not shielding. And actually, I'm going to keep doing what is best for my head and for my headspace to do, because that for me is as important as anything else.
There we go. And Reece, final comments from you, mate. What have you got to say about how you're feeling after all of that?
There's always going to be questions. There's going to be questions for quite some, but again, it's that community, you know, I've discovered online has been amazing. I'm part of Team, the diabetic football community. It's an amazing network of guys who you can get advice and share concerns with, and you know, we always help each other out. And then we've got people like you mentioned earlier, Parthul Carr, who's doing some amazing research, and he's working with government and he's working with NHS to bring us some facts as well. So if we can try and balance that stuff up, then I think that should help us through the rest of this difficult time.
Yes, well, that is it for today's episode. Thank you to my panel, and thank you to you listening or watching along at home like you can do now. If you're interested, if you've been listening along and you're interested in seeing what we all look like, then head over to my YouTube channel, youtube.com/jamie.lowe TV, and you can see this episode in full. This was the first time we've done a panel episode in video, and do let me know what your thoughts are. Do you prefer it, or would you prefer if we just stuck with the audio podcast? Let me know. As always, you can find yourself on this panel. All you need to do is get in contact with me. You can get in contact with me all over the place. I'm Jamie.Lowe TV on all social media, or you can get in touch with me through the All for One pages. So on All for One, on the All for One Twitter, you just need to search for @AllForOneTweets. We are on Instagram @AllForOneInsta. We are on Facebook @AllForOneOnline, or you can just send an email like Elise did, and you can send that to contactall41@gmail.com. But that is just about it for today's episode. Don't forget, there are lots more that you can catch up on our feed. Wherever you listen to your podcast, you'll be able to find us. But thank you very much for watching, and we'll see you in the next episode. Bye-bye.